How you doing, YouTube? This is Prepper Bear here. Today I wanted to talk a little bit about first aid kits, specifically about a level 2 first aid kit. My wife is an operating room nurse, so she has a lot of experience, and some of the stuff may be geared towards that specifically, but you can use the information as you see fit. So basically what I'm going to do is I'm going to go through each of the pockets and show you what's in this kit, and we'll go from there. The Blackhawk Medic Roll Bag can be bought for, I think it was around $35, something like that on Amazon. It's great. It's a great bag. Very, very well made, high quality. I'm going to just start at one end and then go to the other, show you what's in here. Let me kind of give you the big picture first. The bag has a lot of different compartments in it, and it's sort of oriented around the first aid type priorities. You know, airway stuff, bleeding, bandages for bleeding, and some of the things that you might need very quickly, things like scissors and whatnot. Even glasses, you know, if you're older like some of us, may need some up close glasses. One of these pharyngeal nose tubes, that's for my wife. Even a little mini, and we'll talk about that, a little mini surgical kit if you had to do a stitch or two. So this is kind of the big picture. Let me go ahead and go through each individual pocket. This is kind of a large pocket here at the end. I'm using it right now to sort of hold a lot of different things, sort of a catch-all as far as what's in here. Obviously, there's going to be a flashlight in here. We got some clamps. My wife said are very important depending on what the issue is. Here's some little ocular type scissors, very fine scissors, maybe for clipping skin or something like that. A razor. Here's a knife, a little Swiss Army knife that could be of use to somebody. A pair of clippers, always handy. Some tweezers, which, you know, if you have to remove a splinter or something like that. Here's some of these ammonia things that you don't like to take a whiff of. Here's a couple of scalpels. Sterile scalpels. These are the disposable kind that you might need, especially if you have to do some little minor surgery or something like that. I think that's pretty much all that's in this pocket. Fits in there very nicely. Let's just go ahead and move down to this next pocket. Here we've got a couple of creams. We've got some cortisone cream, which obviously if you have some kind of itching or something like that, hydrocortisone, that might be. There's a little tape thing around it just to enhance some storage. That tape, some of that nursing tape. Some triple antibiotic. That's in a small tube. I hit the dollar stores, got a lot of stuff from them. Let's see, across from that little pocket, I do have, this is the little surgical kit. Basically the bare bones necessities if you had to do a stitch or something like that. These are, according to my wife, these are what are called needle drivers. They are, I guess, what you hold the needle with. I haven't actually done any stitches myself. And this is something called a Adderson tweezers. But anyway, there's like a little fang on the end. It's a rat tooth. I think they call it a rat clamp or rat, something like that. Anyway, while you're doing a stitch, you're clamping the skin together. And then basically one package of stitches, I guess. It's got the needle attached to the stitch, to the string itself, to the silk. Reverse cutting. That's what I'm told. Okay, in here I also have some iodine providone iodine swabs. Got 4 of those in here. That is a prep, I am told, for the surgical area as a prep, very common prep. So that's what's in there. And I think the very last thing that's under here, I guess if you are successful in doing your little surgery, you may want some Taga Derm. Taga Derm is this transparent dressing that they put over wounds in the hospital. So there's some Taga Derm in there. Just a couple of pieces. You're not going to do major surgery. You're just going to, if you had an injury that required a stitch or something like that. Okay, let's go to the next next pocket. Some more of this tape is in here. We got some of this green wrap, Corbon, is it? Or something like that. I don't know. It's the stuff that sticks to itself. You get it when you give blood or something like that. Small roll of that. Got some extra batteries in here for the flashlight. Got some super glue. Surprisingly, the uses for super glue, especially when you're injured, are pretty surprising. Even if it's something as simple as gluing your nail after you split your nail or something like that. Very handy for that. Now I'm messing this up. Okay, now I'm getting it. Okay, so got that. On the other side, this is a petroleum gauze. I'm not sure exactly how you use that, maybe for a wound. My wife thought it was very important to have one of these petroleum gauze. It looks like it's super saturated with petroleum jelly in there. So let me fold that up and put that back in there. Oops. Got it? All right. There's some alcohol prep pads in there. And then this stuff, which I guess they use in surgical procedures too, Dermabond. This is like a glue. It's like super glue that it must be sterile. Anyway, it's skin adhesive, essentially. That's that pocket. Let's go to the next thing. I tried to put some of the drugs and things that are most commonly used. My wife's thoughts on this, and then reading other things on the internet of things that people really do need, especially in a first aid situation. One of them is really Benadryl. Having a small supply of Benadryl for someone who might get a bee sting or some kind of other allergy attack. So having that is great. Acetaminophen, because somebody might actually be allergic to aspirin or can't take ibuprofen. These are some Pepto-Bismol tablets. Here's some anti-diarrheal tablets. These are some eye drops. And then there's some of that wool that you put. I have a sheet of this wool stuff that moleskin that you put in your feet if you got a, like a blister or something like that. So it all fits in there very nicely. But these little drugs, some of the core drugs, no real major painkillers or anything like that, but just things that you might need if you were in a first aid situation. On the other side, ibuprofen in a small little package. I got these little packets too off the internet here, off of Amazon. These are great. They fit perfectly, a very small number of pills in a very compact area. Some Vaseline lip therapy stuff. Got aspirin in here. And got some Rolaids type stuff for Tums. So that's what's in that pocket. Let's go to the next pocket here. This is where some of the bandages and such are. Here's a whole assortment of adhesive bandages, Band-Aid type stuff. Here's some Q-tip type, instruments for your ears or other wounds. On the other side, I have something that you can clean your hands with, some wet ones. And then there's a whole series of adhesive or of gauze pads, different 4x4s, 2x4s. My wife says, you got to have a variety. This is very important if someone's bleeding or something like that. So there's a bunch of different sizes that are in here that that can be used just in case. There it goes, fitting back in there again. Uh-oh. Okay, let's see, airway management. This is a critical one, I'm told. Blood in the airway management. Airway obviously is critical. Two things, and this is sort of more my wife's area of expertise, although I do know how to use this thing. I've at least read the directions. I've never really done it. I have had some CPR stuff. But anyway, this is one of these masks that you put over somebody's face, and you know, that way you can do mouth-to-mouth resuscitation without touching lip to lip. So that's in here. It compresses down very nicely and goes into a little bag with the directions on it. Let's see. Beneath that, there's some more additional gauze bandages. Let me put this back in here. Oh, actually, I'll leave that out until I get this out. Now, these are something that my wife has more expertise in than I do. But these are these various size airway management things. And I guess if you're an EMT or something like that, you'll know what they're talking about. But this one has a different size, and supposedly you slip this down into somebody's throat if they can't breathe or something, and then you still need to do you know, CPR and then breathe for them, mouth-to-mouth resuscitation, that kind of thing. There's a bunch of different sizes. It's all the way from very, very small ones, look like from babies, to the large ones. This is very, very small in here. Let's look at this one. Yeah, see that one? Small. There's an even smaller one, a little pink one. That is made for that. So these are Reich, something like that. Berman, something like that is the brand. I don't know how to do this particular. My wife does. But somebody might if they happen to have need for that. So let me go ahead and put these back in here. As you can see, it's pretty tight fit. It's real nice. I mean, it is really compact, and you can really get all of this stuff into this case without much problem. Oops. There we go. Perfect. Okay, so let me put this one on this side. This is this mouth-to-mouth resuscitation thing, shield. Back in there. That way you can see it. I really like the idea on this this pouch that you have clear. That way you can see what's there and what you need. I mentioned before some scissors, some really good scissors for cutting clothes off. These are these standard EMT type scissors. There's one of the military type compresses on it. You've seen them before, the kind that you get that ties itself off. They look like for a gunshot wound or something like that. After you have an open wound, that you can sort of ties itself off. So that's that on that side. The next area down, and I really don't know how to use this, although I'm told, my wife has informed me that this is another way of getting breathing down. These are these pharyngeal tubes that goes through your nose. This one goes through your mouth. This one goes through your nose. Like if you have an injury where your mouth is inoperative, maybe they can stick this down the nose and actually get you to breathe again. This also has the little lube on there, so apparently you need some lube to get that down. And so, not familiar with how to use that particularly. I guess I could shove it down if somebody had a real problem. Okay, let's see. The last areas, I got gloves. I got some of these disposable gloves. And then the last thing, as I mentioned before, I got some old man glasses for up close work if I needed to do something like that. So anyway, that's it. Hopefully that helps you, give you an idea of what's in this case. This is our level 2 first aid kit in this nice Blackhawk roll bag. And I think the only thing missing, and I'm still looking for some prices on it, is some of that blood clot stuff. I really would like to get some of that blood clot material and maybe put that in there. Just one bag of it, just that clotting. But I've read some different things about you know, the pluses and minuses of different blood clot items. So anyway, if you have any questions about what I have in here or where I got this stuff, just go ahead and leave me a question or comment at my YouTube channel, Prepper Bear, and we'll catch you next time. Thanks a lot.